One of the video I talked about the benefits of doing exercise for a diabetes patient and also the dangers of doing excessive exercise. There are different types of exercise that a diabetes patient needs to do, but a word of caution for those who have heart problems, especially heart failure, or people that have had heart attack in the past, people that have problems with their vision, or people that have problems with the kidney. If you have problems with any part of your musculoskeletal system, that means your knee, your foot, you need clearance from your doctor on the type of exercise that is best for you. But what we recommend as the different types of exercise the diabetes patient can do is mainly the aerobic exercise. That is like walking, cycling, swimming, dancing. All these type of exercise are suitable for a diabetes patient. So for a diabetes patient that doesn't have any background problem, you are expected to do minimum of 30 minutes in a day, at least 5 times a week. But it is extremely important that before doing any exercise, you must check your blood sugar. If it is going towards the low side, like maybe it's 4 point something, it is important that you take a snack. You eat something before commencing that exercise so as to ensure that your blood sugar does not go low during the exercise. And it's extremely important that after the exercise, you check the blood sugar again. Please, while doing any kind of exercise, ensure that you stay hydrated. Take a lot of water. And it's advisable that if you're going to do any exercise, it should not be during the afternoon when the sun is at its peak. It's better either in the morning or in the evening. So generally, we advise aerobic exercise. But sometimes for those who are young and strong, you can do resistance exercise. You can do like push-up, you can do like squats, you can even lift some weight, but it should be appropriate for your age. You cannot be more than 65 and be carrying weight of 100 kilograms. Make sure you do the exercise that is appropriate for your age. So for resistance exercise is always better for those who are younger and strong, but for those who are older, you can still carry some weight, but it should be light weight. You should not carry heavy weight. So for the resistance exercise, you can do at least 2 to 3 such resistance exercise per week, right? So you have 30 minutes of exercise 5 times a week for aerobic exercise, while for the resistance exercise like squat, like push-ups, like carrying weight, it should not be more than 2 to 3 times a week. But for those who have heart problems like heart failure or heart attack, it is advised that they do only walk. Do not do any exercise that will stress the function of your heart. For those who have eye problems that cannot see clearly, we don't advise jogging. Make sure you walk and walk while the place is as bright as possible. If you have access to a treadmill, the better. You can do that exercise at home. That will limit the risk of injuries. For those who have kidney problems, it's important still that you do light exercise. A walk is better, but brisk walk will give you more results than when you're walking slowly. So I hope you understand that these various exercise you can do, right? And depending on your health and other background problems, you do that exercise that fits you. Excessive exercise is exercise that you insist upon when you are doing the exercise and still having difficulty in breathing. So if you're having difficulty in breathing and insist on exercise, that is excessive exercise. If you're doing any exercise and you're having severe chest pain and you still insist on doing that exercise, that is excessive exercise. So some people will do exercise 2 hours. Make sure that it's not excessive because your body needs time to recover, right? Because if you do not give your body that time to recover, instead of yielding results, you will be coming up with injuries high blood pressure, low blood sugar, and other problems. So I hope you will heed to the advice I've given in this video.